Now we're going to talk to Daniel Gross of Newsweek. He's written an interesting piece on healthcare hypocrisy. Dan, welcome back to the Young Turks.
Hey, it's good to be here.
Great to have you here. Now, you've attacked the people who are attacking taxpayer-funded healthcare as either practicing ignorance or mendacity. Those are strong words. I like those words. Tell me why you think that's the case.
Well, there's a certain sickness in this whole discussion and debate about health care. And there's this kind of underlying narrative that, certain people deserve, need insurance, and certain other people don't, and that certain people deserve and need to have it paid for by the taxpayers, and certain people don't. Now, Medicare, a single-payer, government-run health care system, covers, people over the age of 65. You add up all the people who work for the military and for Congress and for the federal government, state government, all those people are getting taxpayer-funded health insurance. We hear a lot of people who are recipients of that. I'm talking about older pundits, older columnists, former members of Congress, current members of Congress, people who've spent their lives in the public sector, whose whole financial well-being rests on the fact that taxpayers are paying for their health insurance. And the argument they're making, they're not saying, well, we shouldn't do this, we shouldn't expand this because it's expensive. That's maybe one reason. But they're saying that the notion of taxpayer-funded health insurance is immoral. It leads to death panels. It leads to socialism. It leads to halting innovation. It leads to rationing. They're saying that on moral grounds we have to oppose taxpayer-funded health care for people who don't currently have health insurance, while they themselves have it.
Now
it's a form of madness.
Now let's understand how they might have it. Of course, they might have it through Medicare, but they might also have government-funded health care insurance through what other means, Dan?
Well, I would refer to it as taxpayer-funded health insurance. So, employees of the federal government, which includes Congress and all their staffers, of course, the people who work for the Postal Service. It includes people who work for state and local government. It includes teachers. It includes people who work at public universities. The government accounts for about 16 or 17% of employment in our country, and public sector jobs are more likely to have health insurance than private sector jobs. We have a lot of contractors or companies that just don't feel like they need to offer it. So, when you add Medicare, when you add Medicaid, which is, for poor people, and for government employees, about 40% of the people who have health insurance in this country are already getting it from the taxpayer. And that's all happening without socialism, without death panels, without rationing, without lack of investment. All the negative things they say will happen if we just extend this to other people, none of that has happened thus far.
It's funny because I don't know if you saw it today, Michael Steele came out with a health care bill of rights for senior citizens. Slightly ironic because they're the ones that argued against Medicare in the first place, and now they're saying, oh, don't worry, we're going to protect Medicare from the Democrats.
It's more than ironic. This is part of, remember, the Republicans fought the advent of Medicare and Medicaid tooth and nail in the 60s as a form of socialism, just as they fought the advent of Social Security in the 1930s as a form of socialism. And, of course, once these policies were passed and everyone realized, boy, we really needed this because the alternative is basically a very high poverty rate for old people in this country, they say, oh, yes, well, of course we can't really touch it, and yes, this mantra that you hear of government should not touch Medicare. Well, government is Medicare. And Michael Steele's op-ed, which ran in the Washington Post, and you really have to wonder about the quality control on the op-ed page, because I could not get away in Newsweek or on Slate with writing that type of piece. He talks about how we're going to stop the government from getting in between doctors and patients in Medicare. That is precisely exactly what the government does with Medicare. It determines what treatments are covered and how much the doctors are going to be paid for delivering those treatments. And again, this is where this ignorance versus mendacity. comes in. Does Michael Steele really not know that Medicare is a government program? Of course he knows it's a government program. Does he really not know that the government sets reimbursement rates? Well, having listened to him, I think he's probably stupid enough that he might not know that. But to argue and to sort of rile up and pander to old people, which is essentially what the Republicans have left as a base, sort of old white people, that's mendacity.
All right. Daniel Gross speaking his mind. I like it. So now we have the issue of Medicare there, but it's also a little different than the public option. I mean, it's kind of ironic because I feel like the public option is less government intrusion than Medicare, because what it's saying is we're just going to provide insurance for you guys as an option. We're not taking it over. We're not saying you're mandating it to anybody. Isn't it less intrusive than Medicare?
Well, Medicare is a single-payer system, the type that they all warn against. So that is somewhat different. The public option is basically saying, we will buy insurance on behalf of Americans for people who want to pay into this, and we'll do it on a non-profit basis. In the same way that the government buys insurance for its employees. The federal employee benefits program, which provides insurance for the millions of people who work for the government, works through private insurance companies. It is not a single-payer system. And I've always thought that the simplest way to, or one of the simpler ways to health insurance reform would be to simply open that up and say, hey, if you're an individual, if you're a business with 10 people, if you're a business with 100 people, come into this federal program. You pay basically the rate that we pay, the government pays to insure an individual, and capitalize on sort of the buying power we have with the insurance companies.
Now, we're talking to Daniel Gross from Newsweek. Look, Republicans, to be fair to them, would say, look, we've already paid into Medicare, so why would we not take advantage of Medicare? So that's a little different. But we don't want to set up a new system like Medicare for younger people to take advantage of. Do they have a point there, Dan?
Well, we do pay into Medicare. There's a tax on wages of about 1.45% that's paid by the employee and the employer, but it does not cover the entire cost of Medicare. So the cost of Medicare is coming from other parts of the budget. But if that's the argument they want to make, then they should sort of make that forthrightly, and basically saying is what we want in this country is a wealth transfer from the young and the middle-aged to the elderly, which we're already seeing to a large degree with, first of all, Social Security, and second, this Medicare prescription drug benefit that was passed a few years ago, which is its open-ended entitlement, no way to pay for it, totally paid for with borrowing. If that's what the Republicans are about, basically transferring wealth from people who are working to those who are retired, then make that case. There's a moral, there's a good basis to say that, right? Because old people, private insurers won't insure them because they tend to rack up a lot of medical bills, and they're not very good insurance risks. So if you want to have that discussion, we should have that discussion. But the discussion we're having is about death panels and socialism and Nazism and all that other stuff.
And so here, the private industry actually wins in a couple of different ways, don't they? They say, all right, look, we're going to insure the young people. And now if this so-called compromise that, has not really been hammered out yet in the Finance Committee, but I think probably will be, the Daschle-Dole compromise, if you will, if that gets hammered out, they say, all right, look, we're going to give you more money from the government, subsidized to cover more people through only private insurance. And then when they get to be 65 and they might have real health care problems, then don't worry, the government will handle it, and we'll subsidize that part of it too. So you make all the profits from the insurance on a healthier group of the population as we can find, and the government will subsidize the people with actual problems.
Yes, and also I think it's actually a little deeper than that, because if you look at, I did a piece a few weeks ago where I looked at, how the insurance companies, the health insurance companies, and the number of lives that they're insuring. That's how they count their customers. And of course, we've lost 7 million jobs in this country in the last 18, 19 months. And that means, you know, when you lose a job, you lose your insurance. So the insurance companies have been hemorrhaging private sector jobs, right? You know, the companies that paid for their employees to be insured. So that's really bad for their stocks and for their profits because it's less revenues. The one thing that is holding up in their business is the public component, because there are programs within Medicare and Medicaid where the government pays health insurers to sort of manage the care. It's called Medicare Advantage. And basically that costs more than actually insuring somebody straight through Medicare. So they are already getting subsidized because they are getting a kind of stream of government business that is making up for the loss of the private sector business. The system through which we have insurance that you get through your private sector employer is breaking down. It's breaking down because of the high cost. It's breaking down because companies no longer feel they need to offer health insurance to people because, you know, they have temps and contractors. And it's breaking down because we've been losing millions of jobs. And every time a job is lost, someone loses their insurance. So this state of affairs is actually quite bad for the insurance companies. And, you know, I think the reality is their only hope until the economy really recovers for any type of growth is to get more government business.
It's so ironic, as the Republicans claim, they're against government subsidies for, you know, health care. In fact, those subsidies are going to go to the private insurance companies.
Absolutely.
It's maddening. All right, Daniel Gross actually covering the facts for Newsweek. We really appreciate you coming on with us.
Anytime.